Tobacco and health. What is World No Tobacco Day? It is a yearly celebration that informs the public on the dangers of using tobacco, the business practices of tobacco companies, what people around the world can do to claim their right to health and healthy living and to protect future generations. When is it celebrated? Every year, World No Tobacco Day is celebrated on the 31st of May. This year's theme is Commit to Quit. States with the largest tobacco consumption include Maharashtra, Madhya Pradesh, Rajasthan, and Uttar Pradesh. Prevalence of smoking tobacco usage seen most commonly among middle-aged men and smokeless tobacco among men between 25 to 44 years of age and women over the age of 65. Globally, $1.4 trillion are spent yearly on healthcare expenditure and lost in productivity due to tobacco usage. There are two forms of tobacco usage: smoking and smokeless form. Smoking form includes tobacco can also be chewed or snuffed. These include What is secondhand smoking? Secondhand smoke, also known as environmental tobacco smoke, is the smoke that a smoker breathes out as well as that which comes from the tip of burning cigarettes, pipes, and cigars. Secondhand smoke has more than 7,000 chemicals, of which hundreds are toxic and about 70 can cause cancer. In pregnant women exposed to secondhand smoke, it can cause miscarriage, premature birth, sudden infant death syndrome, learning problems, lower birth rate, attention deficit disorders. In children, it can cause middle ear defects, sudden infant death, long-term development defects, lower respiratory tract infections, decreased lung functions, and cancers. Third-hand smoke is residual nicotine and other chemicals left on indoor surfaces by tobacco smoke. People are exposed to these chemicals by touching contaminated surfaces or breathing in the off-gassing from these surfaces. During each inhalation, more than 5,000 chemicals come in contact with body tissues. Tobacco affects coronary vessels of the heart, leading to decreased blood supply or death of heart muscles known as ischemic or coronary heart disease. This in turn causes heart attack, cardiac arrest, and finally death. In the lung, smoke increases the likelihood of infections and chronic lung diseases like asthma, bronchitis, chronic obstructive pulmonary diseases. The carbon monoxide reduces oxygen concentration of the blood, and nicotine increases the heart rate, thereby raising blood pressure. It also causes atherosclerosis, which reduces blood flow and makes blood clots more likely to form, leading to stroke. Tar in the smoke can coat the teeth, damaging the tooth enamel, leading to tooth decay. Nicotine in the smoke is responsible for the craving associated with smoking. Smoking can cause cataract and glaucoma. In pregnant women, it can cause miscarriage, and in men, it can cause erectile dysfunction and infertility. Smoking not only causes lung cancer but can also cause cancer in multiple tissues and organs, like oral cavity, pancreas, esophagus, to name a few.